Guys, subscribe, like, share, and hit the bell icon. Hi guys, welcome back to the channel. Today we are discussing the anatomy question paper from 2019 to 2024 on CBME pattern by Medidoc by Dr. Bhushan.
This video is for educational and informational purposes only. The exam patterns, formats, and tips shared are based on publicly available information, personal analysis, or experience, and are intended to help students better understand how exams may be structured. I do not represent any official examination board or institution unless explicitly stated. Exam formats and requirements may change over time. Always verify with the official website or source for the most up-to-date information. The strategies and insights shared are general in nature and may not apply to every individual's situation. Viewers are encouraged to use this information as a supplementary guide and always refer to official notifications or trusted academic advisors. By watching this video, you acknowledge that it is meant to support your learning, not replace official guidance.
2019 MBBS degree examination first year anatomy 1. 3 hours minimum maximum 50 marks. Okay. First essay question. This is the first 2019 pattern. First is essay question. Describe the detail about the brachial plexus including its formation, branches and its distribution. Add a note on its applied anatomy for the 10 marks. Okay, is a long question. LQ. Second part is a write a notes on. It's a 20-mark question. 5 question for 4 mark each. First is the inguinal canal, development of microstructure of urinary bladder, dorsal pedis artery, inversion and eversion of foot. Okay. Lobes of prostate and its applied anatomy. Okay. Third part is the short answer on. It is a 20-mark question for 10 question for 2 marks each. First is a fibrous joint, superficial palmar arch, boundaries of femoral triangle, cutaneous inversion of sole foot, parts of uterine tube, varicocele, flexor retinaculum of leg, space of reeds, Schumacher's line, and content of rectors. Next is a paper 2. This is also August 2019. Paper 2 anatomy 2. This is also for 3 hours maximum 50 marks. First essay question LAQ is a describe the detail about the parotid gland. It's a long question. Always it comes for the long question. Parotid gland, add a note on its applied anatomy. Write notes on. It's 4 mark each, 5 questions. First is a cavernous sinus, microstructure of tongue, intercostal space, recurrent laryngeal nerve, relation of thyroid gland. Short note, short answer on 2 marks each. Branches of internal thoracic artery, Well-Burch syndrome, contain a posterior mediastinum, petrigopalatine ganglion, formation of superior vena cava, Bell's palsy, derivatives of secondary pharyngeal arch, embryology question, structure forming limbic system, development of pituitary gland, and transverse sinus of pericardium. This is a 2019 paper. Then August 2020 MBBS degree examination first year anatomy paper 1. This also come for 3 hours. Essay question. Write in detail about the femoral artery under the following headings. First is origin, course, termination, relations, branches. Add a note on applied anatomy for the 10 marks. This is a long question. Second part, microanatomy of hyaline cartilage, lymphatic drainage of mammary gland, thoracolumbar fascia, inguinal canal, facial spaces of hand. Third part is a short answer. Parts of uterine tube, sesamoid bone, Saturday night palsy, caput medusa, perineal body, juxtaglomerus apparatus, Down syndrome, structure piercing the clavicopectoral fascia, suprapubic cystoctomy, content of laser momentum. 2020 second paper anatomy. Essay question is Write in detail about thyroid gland under the following headings: situation, lobes, covering, relations, blood supply. Add a note on applied anatomy. This is asking about the thyroid gland for the 10 marks. Second is the sinus of pericardium, nasal septum, cerebral peduncle, histology of cornea and hyoglossus. Third part, fillet of tetralogy, pleural recess, corpus callosum, auditory tube, ligamentum arteriosum, paratonsillar abscess, Weber syndrome, ciliary ganglion, tendon of Tordo and reticular formation. For the 20 marks, 10 questions, 2 marks each. This is 2021 fifth question paper, paper 1 human anatomy for 3 hours. Okay. Here is a question paper was changed, pattern was changed, first part and second part. Here is a 100 mark paper, 80 for theory and 20 for MCQ. Our write a short note, just a previous short note is cancelled for 2 marks. Then add for the 2 long question. Describe the mammary gland under the following headings: extent, relation, blood supply, lymphatic drainage and clinical anatomy. 15 mark question for 2 into 30. Discuss the uterus under the following heading: position, parts, external feature, relation, blood supply, lymphatic drainage and clinical anatomy. For 15 marks, 2 questions. This is a LEQ. Write a short notes on following the questions. This is for 50 marks, each 5 marks. Structure under the gluteus maximum, greater saphenous vein, femoral triangle, adductor magnus, ligament of knee joint, rectus sheath, earth point, rotator cuff muscle, microstructure of esophagus and development of pancreas. This is the first paper. Second paper, 100 marks for 80 theory, 20 MCQ. There is also two questions for 15 marks each. Describe detail in blood supply of heart and its clinical anatomy. Okay. And second is a discuss the pharynx under the following headings: extent, parts, feature, blood supply, muscle forming and its clinical anatomy. Total 30, 15 each. Second part, write notes on floor of fourth ventricle for 5 marks. External jugular vein, secretomotor inversion of parotid gland. This is also one of the LAQ. Cartilage of larynx, superior mediastinum, development of face, histology of thymus, pleura, plaques cerebri and circle of Willis. Circle of Willis also is an important question. Second, this is a 2022 year question paper for the candidate admitted for the academic year 2019 to 22. This is also 80 marks theory and 20 MCQ for the 100 marks. First is a long answer question. LAQ, describe the formation, parts of relation, branches and tributaries of portal vein and enumerate the sites of portosystemic anastomosis and clinical anatomy. Second is a discuss the type and articular surface, capsule, ligament, bursa, relations, movements and muscle inward and clinical anatomy of hip joint. Here is a hip joint, here is a portal vein. Then write short notes on popliteal artery, cephalic vein, tibialis anterior, interior of anal canal, development and descent of testes, common bile duct, histology of elastic cartilage, axial group of lymph node, ulnar nerve in hand and cubital anastomosis. ये hand है. Next, paper 2, February 2022. LAQ, first is a define the boundaries and content of posterior mediastinum Describe the formation, course and relation of termination and tributaries of azygous vein. Azygous vein. Kindly note that azygous vein. Second is explain the situation, extent, parts, relation, capsule, blood supply, lymphatic drainage and clinical anatomy of thyroid gland. Previously here also asking about the thyroid gland. This is important question. Write a short notes on second part. 10. Extracranial part of facial nerve, histology of lung, maxillary artery, derivatives of third pharyngeal arch, nuclei and connection of thalamus, external jugular vein, internal structure of midbrain at the level of superior colliculus, circulation of CSF and anatomical basis of hydrocephalus, attachment, extent, nerve supply and action of intercostal muscles and Turner syndrome. Next, this is August 2022 paper first. This is also 50 marks. Essay question first is write a detail in mammary gland under the following headings. There is also previously asking about the mammary gland. Situation and extent, deep relations, structure, lymphatic drainage, clinical anatomy. Write notes on anastomosis around the scapula, support of uterus, ligament of knee joint, microscopic anatomy of skeletal muscle, microscopic lumbar plexus. This is a 4 mark each, 5 question for 20 marks. Third part is a write short answer on position of appendix, Colles fracture, covering of kidney, perforator of great saphenous vein, callow triangle, episiotomy, laser omentum, musculocutaneous nerve of lower limb, guy rope muscle and content of erector sheath. This is the second paper 2022. First is a write in detail in parotid gland. Parotid gland previously also asking. This is an important question. External feature, relation, clinical anatomy, secretomotor pathway for the 10 marks. Second part, write notes. Bronchopulmonary segment, histology of cerebellum, external carotid artery, development of tongue, internal feature of right ventricles. Short notes, third part, 2 marks for each. Tributaries of internal jugular vein, pleural recess, part of lateral ventricle, commissural pressure, commissural fibers, intercostal muscle, nuclear thalamus, extracranial branches of facial nerve, thymus, brainic, and muscle supplied by recurrent laryngeal nerve. Empty question. Next, Jan 2023. First paper. Here is a pattern change from the university. Is only we see the only pattern and mark distribution of the paper. First is a essay question, part 15 marks each. First is a describe the boundaries of content of axilla. Write the origin, course, relation, termination, branch of axillary artery in details. 2 questions here. First is the content of axilla and boundaries, and second is the axillary artery in details. Second question asking about the uterus. Describe the uterus in detail under the following headings. First is the position and parts, peritoneal and visceral relation, supports, microstructure, development and clinical anatomy. For the 15 marks, you write all the headings. Then part 2 for the 5 marks each. Abductor nerve, facial space of hand, right suprarenal gland, hamstring muscle, neurulation,
histology of liver,
knee joint and Erb's palsy. Paper 2, January 2023. Here also 2 parts, essay and write short notes. First is a describe the sulci and gyri, functional areas of supralateral surface of the cerebrum and its arterial supply and applied anatomy for the 15 marks. Second is describe the boundaries, content and applied anatomy of carotid triangle. This is also question or previously asked. Short notes: mediastinal surface of left lung, corpus callosum, pharyngeal pouches, lacrimal apparatus, superior orbital fissure, right atrium, histology of trachea, cavernous sinus thrombosis, left pharyngeal nerve, and muscle of mastication. This is for the short notes. March 2023. This is a CBME pattern, Human Anatomy Part 2. Essay question first. Describe the pleura under the following headings: features, relations, surface marking, clinical anatomy. And second is a scalp and clinical anatomy for the 15 marks. Now to draw diagrams, write a short notes on following for the 50 marks, 5 marks each. Typical intercostal nerve, Meckel's cartilage, cavernous sinus, histology of thyroid gland, buccinator, linguinal artery, carotid sheath, cerebral nuclei, nasal septum, interpeduncular fossa. March 2023 is supplementary CBME pattern Part 1 Human Anatomy. This is also 2 part, 15 or 50, 13 or 50, 80 and 20 for the MCQ. First, describe an origin, course and relation branches of distribution of median nerve. Add a note of effect injury median nerve at the elbow. Second is a urinary bladder. Parts, relation, ligament of bladder, interior of the bladder, microstructure, development and applied anatomy. All the about the urinary bladder. Part 2, superior mesenteric artery, cutaneous innervation of palm of the hand, gluteus maximus, midgut rotation with related anomalies, lymphatic drainage and blood supply mammary gland, great saphenous vein, histology of testes, arches of foot, vermiform appendix and femoral hernia. This is August 2024. This is recently paper Human Anatomy for past Part 2 first year. There is also same pattern, 80 theory, 20 MCQ. Add appropriate diagrams whenever necessary. You have to draw diagram for the all questions. Here is a pattern. Here add a clinical history. First, 48-year-old female presented with history of pain and ulcerative lesion in tongue, diagnosed to have carcinoma of the tongue. This is a clinical history, but the question is describe the parts and muscle innervation, lymphatic drainage and histology of the tongue. You have to write about the tongue. Second is a 58-year-old male patient presented with severe pain localized to left thoracic region following the shingles involving the left T6 dermatome. Define the boundaries and content of intercostal space. Discuss in detail about the typical intercostal nerve. And last is second part, arterial supply of cerebrum, its clinical anatomy, development of interventricular septum of heart, carotid triangle, third ventricle, karyotyping, ciliary ganglia, inferior cerebral peduncle, masseter, component of connection of corpus stratum and thoracic duct. This is a recent paper. This is a last question paper of 2024. This is part 1, paper 1. First is a essay question. Is a 60-year-old man complained about the difficulty in starting in urination. He also had sense of incomplete emptying of the bladder. You have to write about the urinary bladder. Name organ involved in this patient. Mention its external feature, gross anatomy, give relation, blood supply and anatomy. Second is describe the knee joint following the headings: bones forming, ligament, bursa, blood supply, node supply, applied accept. And second part is a right short node. Draw and describe the structure of from microscopic anatomy of lymph node, radioulnar joint, flexor reticulum of wrist, tender calcaneus, bare area of liver, cadaver ethically, major opening of diaphragm, covering of kidney, and internal pudendal artery. This is a previous question paper. Go through it and make for the degree examination. Best of luck to all the students. Thank you. Please like, share. Made it up by Dr. Bhushan. Thank you.